Alright, let's take a look at your respiratory cases that you did last week or the week before. Hope you had fun with it. I will definitely have fun grading them. I don't know when I'll get to do that since you have 80 students in this class. Yeah, so it will take me a while before I get them back to you, but I don't want you to not study for your next hour exam. So please do start studying for it, and this tutorial should help you with your case study part of the exam. I do admit that respiratory case studies, this was one of your harder ones to solve, partly because of some math involved here. But if you guys like doing math, then this was probably easier for you. Right now, the first case study we looked at was about a 17-year-old student. And first of all, whenever you're solving a case, I think you already know this, but it's always good to know if the case is about a woman or a man. You know, male, female makes a difference. You know, some values, for example, normal ranges, whenever you get the laboratory data, some values depend on the sex as well as, you know, height and ethnicity a lot of times. So the more information you have about the person, the better it is. But this is just your, like, you know, A&P class, and we're not getting into all that detail. But still, the fact that this is a case study about a girl helps you know what normal ranges you're looking at. So anyway, the 17-year-old student has experienced, it says, a reversible periodic attacks of chest tightness with coughing, wheezing, and hyperpnea. Now, all four indicators here, the chest tightness, the coughing, you know, the wheezing and hyperpnea, which is increased depth of breathing, all of them are indicators of asthma. So you kind of already have a clue to what that is. But to make sure, you can always look, you have to always look at your lab data as well. Another thing, she states that expiration is more difficult than inspiration. So it's good to have that information as well to solve the case. She's most comfortable sitting forward with arms leaning on some support. X-rays revealed mild overinflation. You know, overinflation just means the increased expansion of the lungs with air. Results from lab and pulmonary function tests are as follows, and you have all these different values here for all the different things we're looking for in our respiratory case. Most of the time, this test is done really quickly. We do a spirometry. You just breathe into it, and you have all these values you get from that, and it's all computerized. First value we see is the frequency of breathing, which is also another name of this is respiratory rate. And you can see in the case that the frequency of her breathing was 20 breaths per minute. Now, if you check that out, you would know that the normal frequency of breathing is around 12, maximum 20, but that's already a lot more. So we would say her frequency of breathing is above normal. Vital capacity here, which means your maximum volume of air that you expel, that volume here is 2.9 liters. Now for a female, normal value for vital capacity is 3.5 liters. So knowing that, we can see the vital capacity here is low. Another value here is your forced expiratory volume in a minute, which is FEV 1.0 in short, and that value is 1.4 liters. Normally this value comes up to 3 point some liters usually, so that is again very low. Another value you see here is FEV 1.0 over FVC, and this is giving you the percentage of your expiratory volume, and that is 56%. So this is the volume that you expire, and you can see that 56%, the normal value is 75 to 80%, is very low, which already tells you one of the things in this disease, which is there's a problem with expiring. She's not letting go of this air. The value there is very, very small, so you could think that it's probably some kind of obstruction there, internally. Another value here is your FRC, the functional residual capacity, and that value is 3.89 liters here, which is very high. Normal for a female is 1.9 liters. Now, when you know that functional residual capacity is high, that means the residual part after breathing out, whatever is left is a lot here, 3.89, which means she's not maximally releasing that. That also tells you another thing, which is probably there is some obstruction there in some of those places in your bronchus, most probably. Another value here you see is your total lung capacity, TLC, which is 6.82 liter. For a female, a normal value for TLC is 4.7 liters, so obviously that is high. Then you have the partial pressures for oxygen and carbon dioxide. Remember from your textbook that your oxygen partial pressure in blood is normally 70 to 100 still, that's okay. More is not bad. Partial pressure for your carbon dioxide in blood is 35 to 45 maximum. So her partial pressures for both the molecules, both those gases, oxygen and carbon dioxide, is low, which tells you again that it's probably obstruction. Something is blocking for maximum respiration to happen. Her pulse here is 108 beats per minute, which is okay. Her blood pressure is also okay. It's 120/76. It says intermittent use of a bronchial smooth muscle dilator for several days caused marked improvement, resulting in the following lab pulmonary function tests. So after the treatment, and the treatment was with a bronchodilator, and the drug they use there is epinephrine, and they usually give it with a nebulizer so you can inhale it and take it in. But the epinephrine here, remember what that does, it's beta 2 receptor agonist. Anyway, after the treatment, all the values that you look at basically have changed now. Your vital capacity became normal, FEV 1.0 also close to normal, FEV 1.0 over FVC is again 75%, which is normal. FRC 3.7, close to normal, it's okay, a little high. TLC also close to normal. Partial pressures of oxygen and carbon dioxide is normal. Your pulse is higher though, 129 beats per minute. So the pulse is higher. Your blood pressure is 122. So from 120 it went high to 122. So it's slightly elevated now. So those are the two things that have markedly changed after the treatment. Everything else changed but became normal, as you can see in there. So we would say the treatment has worked. Now, the first question was, what is the disorder of this 17-year-old student? I would say, based on everything we know, the chest tightness, wheezing, coughing, and hyperpnea, the laboratory values we found of your expiratory volume being lower and your partial pressures for both the gases being lower, all of that, and of course frequency of breathing, that being slightly higher, all of this indicates that she probably has asthma. Right? And as you can see, when she was giving a bronchodilator, she got well. All the values became normal almost. So there is a good chance, I would say, that she has asthma. Yeah. Number 2 says, is this primarily a restrictive or an obstructive disorder, and why? I think this is an obstructive disorder because of all the values we saw. Remember because of the obstruction, the partial